Welcome back to Good Morning LaLa. We're honored to have Dr. Sherry. She is the author of Sheology, which is the definitive guide to women's intimate health, period. And so nice to meet you.
Welcome to the show.
Thank you so much for having me.
She has a lot of talk about vaginas, but today we're going to be talking above the belly button, about the heart, which is fascinating.
That's right. Well, the gynecologist, the OBGYN has true commitment to the heart as well. So I'm pleased to be here to talk about heart health.
So tell me, how does the two correlate? Because I don't think very many women know to have this conversation with their OBGYN.
I mean, we know it's oneness, we know the whole body's one system, but
exactly. We're looking at the less traditional risk factors for women as it relates to heart disease. So hormones, reproductive factors, they're all part of our risks. And we look at pregnancy as the first stress test. So there's many issues that bring out the less traditional risk factors for heart disease.
So if you're a woman, what do you have to look out for in terms of the risk factors?
Well, the main ones really can start with birth control and whether you smoke or whether you have high blood pressure, because we know your risk is so much higher for those problems as it relates to estrogen.
And then really?
Yeah.
I mean, that shocks me because from a very young age, for various reasons, I've been taking birth control. And does that increase my risk?
If you're healthy, it does not increase your risk. And if you smoke, which you probably don't.
No, I don't.
You don't have an increased risk.
Oh, but that's so fascinating. You know, it's not something that typically we're told,
exactly.
Right? What about women versus men and the factors of heart disease?
Well, again, heart disease affects men just as much as women. But for women, we know things are subtle, more subtle. The symptoms of a heart attack, for example, are more subtle. And because pregnancy can show a lot of risk factors, if you had high blood pressure, like preeclampsia or diabetes, these are things that bring out your risk. So you can know in your 30s if you're at risk for heart disease, and you can start taking action and do something about it. And that's really the message that we're hoping to get out there, is that women in their 20s can start paying attention to their risks.
Wow, it's so fascinating. So do most OBGYNs test for this? Do they make the connect? I mean, is this something?
You know, this is a new conversation. And I'm really, one of my missions, not only to bring education and awareness to women, but to get the conversation, to bring OBGYNs to the round table, because we are the first at the gates to identify women at risk.
Wow. I think it's fascinating because, you know, my father's a homeopathic doctor, a natural doctor, and the Western, and I believe that when they come together, it's the most powerful preventative and diagnostic and everything above. But so, like, even with Jessalyn, you know, taking the pill, which so many women do, you know, no one tells us that it strips us of so many nutrients, and that in turn, who knows what that turns into, right? So where do you start and where do you stop? I mean, heart disease is, you know, I don't know how you distill it down into specific topics.
Yeah, I think because, you know, a woman dies from heart disease every 80 seconds. And we don't think about 1 in 3 women dying of heart disease, more than all cancers combined, including breast, ovarian, and lung. So I think that we all have to pay attention to these risks, and how can we prevent them? If 80% are preventable, what can we do early on through homeopathic, you know, Eastern methods, through healthy living, you know, exercise, diet, just those good old lifestyle changes that will help reduce our risk. So everyone has to be involved, not just the general doctor and cardiologist.
Well, but you play a vital role because, to be honest, most of my girlfriends here in Los Angeles don't even have a GP. Healthcare is not as accessible as one would like to believe, and it is really expensive. So the one appointment we do make is with our gynecologist, and we're trusting them to give us all the information we need about our entire well-being.
It's true. It's true. I mean, most women see their gynecologist up until 50, or until their OB kicks them out and says, get an internist. So this is important. I mean, even the OBGYN is new to this conversation, but because it is an epidemic, just like loneliness, you know, this is something we have to pay attention to because it's so preventable.
So what was the crossroads, the tipping point for getting this conversation started with the OBGYNs and connecting the heart disease world?
You know, the tipping point, it's going to come from being your best advocate as a patient, because a lot of OBs are just learning this connection as well. I mean, heart disease and screening, I believe, should start in your 40s. And we don't know, you know, mammogram, you know when to get, pap smear, even a colonoscopy. But when do you get tested for heart disease? So it's knowing your numbers, it's knowing your cholesterol, knowing things that are related to blood pressure and to diabetes, and of course keeping your BMI down and not smoking, and some of the basic things. But you patients need to be reminded.
So fascinating. From a spiritual perspective, as a doctor of divinity, a lot of the time we talk about that there's always a correlation to our emotions, to what's really truly going on. And I'm a true believer that if something's going on with the heart, there's actually something going on emotionally as well that plays into releasing those hormones, or not, also along with the food we're eating, along with all, is like there's no disconnection, it's all one. What do you feel like when you work with clients and you're looking at heart issues, how much of a correlation do you think there is with what's going on with them?
I completely agree with you. I mean, mind-body connection it's so present. And I think stress, as it relates to our health, is, it's unfortunate. And we all, as women, now that we are mothers or we're working, we're juggling finances and relationships. I mean, it's not easy. So all these things emotionally and spiritually affect us and can increase our risk of heart disease.
Are there special considerations too for women that are pregnant, or maybe they're going through menopause?
Yeah, I mean, these are all, again, sort of the hormonal link to it. And we know menopause can affect heart disease. It doesn't cause cardiovascular disease, but it does increase our risk. Hormones, I'm a fan if you need it as you go through menopause. But hormone replacement therapy does not cause heart disease either. So it's paying attention through every hormonal decade, beginning in your 20s, going up through perimenopause. So it's all related.
Well, and I know that you are an expert in the 7 cycles.
That's right.
That women go through. Could you briefly tell us about what that is?
Yeah. So it's just a different way. The 7 cycle approach looks at women's health in a very sort of micro specific way that we haven't really done. You think of hormonal cycles, puberty and menopause. You don't think about pregnancy being a hormonal cycle, or postpartum being a hormonal cycle, or even infertility. So I like to identify these specific cycles, pay more attention, and treat women for their needs as we go through things like depression and anxiety during infertility. So trying to pay more attention to women, and I think we optimize health by doing so.
I think it's profound what you're doing, because as a Western doctor, which you are, it's really, I think you are the leader for me anyway, that where you are saying yes, and we want to take all these other factors into consideration. So thank you. Thank you so much for being open-minded and looking at a bigger picture as well.
I think we have to, as doctors, no matter whether you're Eastern or Western. I think we all work together and for the greater good of women and patients in general and their health.
Right? So good.
It's exciting.
It really is exciting.
Well, we have a very special event to talk about. We're going to bring Vina back in later in the show and talk about Rock the Red, because we're really excited to be celebrating you, to be a part of this community and spreading word and awareness about heart disease on May 17th. So we'll tell you more about that later in the show. Stay tuned. We'll be right back.